Thank you, Chairman. Thank you for the recognition. Thank you for being here. To our witness, and good afternoon to everybody. Gosh, the Center for Medicare and Medicaid Services, they safeguard our taxpayers. That's what you're here for. And you would think if anything could be bipartisan in this committee would be when people do fraud to take away resources for people that really need them. I mean, people really need Medicaid. It is important that they have. And when fraud just robs them of that. And there are people that set up these groups that aren't just overcharging or misbilling, which was brought up the other day, improper payments. We're talking people that set up fraudulent businesses to take money away from the people that need them the most. And not only money away from people that need them the most, taking them out of the pockets of hard-paying taxpayers. It is frustrating that this can't be bipartisan. And Florida is now, you just noticed Florida is under investigation. I just saw Governor DeSantis. He's not a Democrat, I can promise you that. The other, I know that I sent a letter to Nebraska. So we're gonna follow where the fraud is. And if the fraud is in Democrat governors, we're gonna hold them accountable for it. If it's Republican governors, we're gonna hold them accountable for it. Because the people that need this program the most are the ones who are most vulnerable. You think about who's vulnerable to fraud. We have behavioral analysis for children with autism. We have those kind of programs. Non-emergency medical transportation has been in fraud. Those programs, substance use disorder treatment, people who really need those programs are being robbed because people are robbing the hard-paying tax dollars. And so, for example, just last month, a Russian citizen was charged in an alleged $3.4 million fraud scheme involving Medicare claims for durable medical equipment. Today's hearing provides an opportunity to examine how much CMS has strengthened its efforts to detect fraud sooner, prevent fraudulent payments, and improve coordination with states and law enforcement agencies. It is also an opportunity to identify reforms that can further strengthen program integrity while protecting access to care for millions of Americans who rely on Medicaid and Medicare. And I look forward to from hearing from you today how we're going to deal with it. And gosh, if you think anything could be bipartisan, is when people defraud the taxpayers that work hard for the money, who generously, through the programs, give it to people who are the most vulnerable, and they're being taken advantage of. They're being taken advantage of when people don't take this seriously as well. And I will yield back.